Hey, everybody. Thank you so much for joining us on the live stream. We've got another fun conversation here for National Rehabilitation Awareness Week. We are chatting with some of the team here at our Grand Rapids location, and we are reaching across the rehab spectrum. All in the room together with us, we've got a nurse and we've got a speech-language pathologist kind of talking about the field, different areas, how they can work together, and what is unique about their discipline within rehabilitation. We've got Mindi Sobol. She is a clinical nurse educator, former nurse on the floor. And we've got Claire Antvelink. She is a speech-language pathologist doing outpatient with adult neuro. So thank you both for joining me. We're in the same room, so you'll see us looking around and talking to each other. Mindi, if you just want to introduce yourself, tell me a little bit about your time at Mary Free Bed and the different kind of places you've worked around here in the Grand Rapids campus.
Yeah, so I started my nursing career here at Mary Free Bed. I went to Grand Valley. I'm originally from the east side of the state, and Mary Free Bed has kept me here all this time because I love what we do. And I worked as a floor nurse. I worked as a supervisor. I was a nurse manager for a little while, and now I transitioned into education. And I love teaching people about what we do here at Mary Free Bed and making them experts as they care for our patients.
That's awesome, because education is just so important, because healthcare is always growing and changing, and you're learning new things. Claire, can you share a little bit about yourself and what you do within the outpatient world?
Yeah, so I've been at Mary Free Bed for about 4 years, primarily doing outpatient adults, and the majority of my caseload is post-concussion, but I do also see general neuro patients with strokes, TBIs, and hip and neurodegenerative disorders. So I kind of do almost everything in outpatient.
And so this is really cool to have two different people in different sectors of it. So Mindi, in your time on the floor, you actually worked with speech-language pathologists. Can you share how rehab is just unique and how you collaborate with different disciplines and how you might have worked with a person like a speech-language pathologist with a patient?
Excuse me. Yeah. So nursing works very closely with all of the different disciplines. Speech is one of them. Speech is very helpful for us, telling us what patients can eat, how they can drink, what's safe for them, and helping patients with their cognition, their memory. If we have any concerns with patients swallow, we'll reach out to their speech therapist, and they'll typically come see them as soon as they can or send someone else to make sure that they're safe as they're eating.
And I always joke that speech-language pathology is like the worst marketed, because like the name, there's so many different things that you do. Like, how would you define like speech-language pathology?
Yeah, it definitely encompasses a lot more than just a name makes it sound like. So like Mindi said, we do a lot of cognitive communication is what we call it, attention, memory, problem solving. There's some of the different cognitive skills related to communication. And then we also do speech, so that would be your articulation or the way that you sound. We can do voice. We can do swallowing, like we even mentioned as well. And then we do language. So it could be expressive language, like coming up with the words that you want to say, or putting sentences together. Or it could be receptive language, and that would really be your understanding of what's being said to you. And it's at all different levels. So yeah, we do a lot.
Mindi, the world of rehab is so unique, and there are probably a lot of nurses out there who are in acute care settings, long-term care facilities or something, but they might not know exactly how rehab nurses work. What are some of the differences for that?
Yeah. They don't talk about rehab nursing in nursing school, and they tell people that they need to start in med-surg, but at Mary Free Bed, we're in acute rehab, so we have patients who have a lot going on with them. So in nursing, you'll still get a lot of those experiences.
Just so many different worlds within they work. And, I've heard sometimes people say, like, oh, it's so easy that you're working there in rehab, but it's not. It's very intense. And I think a nurse who worked in spinal cord injury talked about how they're really involved at the very beginning. And then as the patient gets better and better, they're kind of like stepping back. Have you had that with patients that you've worked with?
Yeah. What's amazing about Mary Free Bed is we want them to be independent, right? And even those patients who can't physically make gains to be independent physically, we work on verbal independence so they can still direct their care and have control over what's going on with them. Rehab nursing, we assist individuals with disabilities or chronic illnesses to attain and maintain their maximum function. We see miracles here every day at Mary Free Bed. It's just amazing. The things that I've seen over the years, you're gone for a few days and all of a sudden the patient's standing, and then you're gone a few more days and they might be walking, or all of a sudden they can eat and they weren't able to eat before. It's just so cool, all the things we see here, and we walk through it all with the patients and their families. That's a big difference about rehab. We include the family in everything we do as well.
Yeah. Claire, you've probably seen that as well too, the progress. And when they work in outpatient, they're inpatient, they're in there every single day, but you probably see patients maybe a little bit less, a couple of times a week. What's the progress like that you see for patients?
Well, a lot of times after they leave inpatient, they'll come to outpatient. And we typically don't see them every day or quite as frequently, but perhaps 2 to 4 times a week. And still working on those skills to help them be independent, but also, skills to help them get back to work, get back to driving. A lot of those higher level activities of daily living that they haven't been able to do from their injury, that they want to get back to. So it's really exciting watching the progress of helping patients get back to their lives.
Each of you, I bet, have really unique, memorable moments or successes. Mindi, over all your years here, was there one moment that kind of really stood out to you as just like, wow, this is why I do what I do, and this is just such a memorable moment?
There's so many. I mean, I've been here almost 22 years. Just something more recent, I guess, that there was a video on. There was a patient on the spinal cord injury, and that's where I worked, on the floor, spinal cord. So my heart is always there, although I love all of our different units. But there was a patient who fell from a tree stand. She was an incomplete tetraplegic, and she ended up walking out through the tunnel, and her boyfriend met her at the end and got down on one knee and proposed to her. And she said yes. So that was something really cool to experience.
Yeah, that was a fun story to hear and be a part of and be behind the scenes. And it just to see that how important family is in recovery, that they all supported her and to help get her to where she's at. Claire, any recent success stories that you've seen that really stand out?
Yeah, I like Mindi. I mean, as far as even she's been here way longer than me. I've only been here 4 years, and I've seen so many success stories. So I think really anytime I have a patient and I get them back to work and it goes, wow, that's really exciting. We celebrate that success. Or even, patients that pass their driver's evaluations and make it clear to go back to driving. That's a huge independent activity that patients really want to get back to. So anytime that happens, we really celebrate that. I had a patient recently that got an AAC device, which is augmentative and alternative communication. And we also did that in speech therapy. And then they learned how to communicate using that AAC device because perhaps they can't do it verbally. And that's always really exciting too. So, big or small, we've seen a lot of successes and they're always exciting for us.
Mindi, you've worked recently now changing over to education and you're helping to support our team. What's that like, and why would you say education is so important in the medical field?
Well, first of all, just educating the new staff members about what Mary Free Bed is, what rehab is, rehab nursing specifically, because that's what I focus on for education. But it's so important just to teach them what we do here at Mary Free Bed, and then continue to educate our staff who are here, come up with new things that are on the horizon and work them into our practice if it makes sense. And it's just great to teach all these new people and the old ones as well.
Claire, you work a lot with post-concussion. Is there something about that in working with those patients that really fills your bucket, that makes you kind of see why you like this field of speech-language pathology?
Yeah, I think as with a lot of adult patients, there's a lot of motivation there and they're excited to get back to these activities. So really just being able to work on that and see the progress is what makes me excited and keeps me coming to work every day.
And as we start to wrap up this interview, I want to ask you each, what is just so unique about working in rehab? And, this is a chance to celebrate and educate about rehabilitation, but why should we be celebrating our teams here and the hard work that our staff does and in that world that's just so unique?
Well, what's unique about Mary Free Bed is we involve the families. We journey with the patients and their families as they figure out what their life will look like when they leave Mary Free Bed. It might not look exactly the same as before their accident or injury or whatever brought them here, but there's still ways that they can do a lot of the stuff they used to do, and that's what we do here at Mary Free Bed. We teach them how they can still function and lead a life outside.
Claire, what about you? Why should we be celebrating this unique world of Mary Free Bed and rehabilitation?
Yeah. Well, rehab is so exciting because after injury, like your brain just has so much potential to rehab itself. So that is amazing. It's something to celebrate. And the culture that we facilitate at Mary Free Bed, obviously an inpatient with Mindi, then an outpatient, it's a positive environment. And I think that all of our therapists really work hard to restore hope and freedom, which is our goal. And I've had a lot of patients tell me that we do feel like we met that goal.
That's awesome. This has been so great chatting with you both, talking about different parts of the world of rehabilitation. It is National Rehabilitation Awareness Week, a chance to celebrate and educate the public about the great work here and all of our team. Make sure you stay tuned on our social media feeds for more conversations from around the state, talking to clinicians and just sharing about this great work that we do in rehabilitation. Thank you so much for watching, and stay well.